Hello, welcome to the National Guild of Hypnotists Washington chapter. We're so glad that we are together this evening on February 9th. We're going to be learning from Eve Lesher. So in just a moment, I'm going to pin Eve so she can begin her presentation to us.
Okay.
And you are pinned. Go ahead, Eve.
Okay, let's see if we can share the screen. And does that look good? Oh,
It
it's
is
loading.
coming up now, and if you can push the little slideshow button so we don't see the side slides.
Yeah.
If you
Does it
it's
work?
on the bottom corner on the right. But anyway, go ahead, just start chatting. We're not that picky here, so we're good. Okay, go ahead, Eve.
All right. So for those of you who've known me for years, I've mostly been an educator. I've been a registered hypnotherapist and trained since 1992. I kind of dabble. My favorite thing is working with pre and post surgical. So that's my focus this evening. I am certified to train hypnotherapists through the National Guild of Hypnotists. I really like teaching. I have retired from being an educator with Seattle School District, and I'm in my gap year as I explore where I'd like to end up, because I'm not really sure. So today I've been asked to do a presentation for you, and I'm going to do the benefits of pre and post-surgical hypnosis. And the question is why is this what I do? It's because I know it works. I've had more surgeries than your average person, and I've never had complications. I have always recovered very quickly on like the high end of the recovery scale. So I know personally that this is something that's valuable. Okay, second, there's research behind it. And I will be presenting that to you as we go along. And the last page is a list of the sources that I used for this. And finally, the results are tangible. And again, that's based on the research that has been done over time. And this is what you are going to be doing, educating your client about if you choose to use these to work with pre and post-surgical clients, okay? So, so my personal experience. So what does the research say? All right. First of all, what we want to do is we want to know what the protocol is. And it's like 3 steps. Number 1 is you want to find out what they're dealing with. Number 2, you want to educate them. And then number 3, you're going to do the hypnosis. All right. So you want to find out what the client is dealing with. What's their story? Is it hip replacement? Is it knee replacement? What have they been told to expect about the procedure? Is it going to be a terrible recovery process? Is it going to be a long recovery process? Is it going to be a difficult procedure? Is it a lot of times, unfortunately, the surgeons don't have very good bedside manner. They will, and legally, they have to give you the information so that way when you're signing off on the permission to do the surgery, you have to have been well informed. So they have to tell you all of these things, what could possibly go wrong. They might know somebody in the family that did really well. They might know somebody in their family or circle of friends who've been very, had lots of difficulties, lots of complications, and every time they turned around, something else went wrong. So you need to know what their expectations are based on what they believe and what they've learned from the people in their lives. Okay. All right. And again, is how has their surgeon already programmed them? Has they encouraged them about, like, my statistics are such and such that most people recover at an 80% recovery rate? How have the surgeon, or how did the surgeon make things more positive for the client? Okay, but a lot of times we're going to find that there's a lot of negative programming that is put into the surgeon's preparation of the patient. Okay, so we want to know what their fears are, what their expectations are, the stories that they've heard, and then you are going to give them what I consider the most important phrase. And I stole this. I have no shame. I'm a teacher. I teach. I like best practices, even though that's kind of a catch-all phrase these days. It's really important for you to remind your client that the surgeon, their friends, their family, and other influences in their lives did not know that you were going to use hypnosis, did they? And so all of a sudden, it takes away the onus of, oh my God, this is terrible. I trust these people. They told me their stories. They told me what to expect, but they didn't know we were going to use hypnosis. And so therefore, that kind of opens the door for them to believe in having a much more positive experience. And so that is probably one of the most important things that you are going to say and repeat as you go through your time with your client. They didn't know, nobody knew you were going to use hypnosis. And then this is where the education comes in. Okay, so you talk about the research and the benefits. And like, for example, I've had several clients, one who had needed a hip replacement. She was a colleague, a coworker, a teacher. She had been in pain for so long that when she came to me, she could barely walk into the door, and there were no steps into my condo at that time. And it was really, really difficult. She hadn't been able to do food shopping. Driving was painful. Working was painful, but she had to work. She was a substitute teacher like I was, so there was no getting around. There were no sick time. There was no medical benefits very much. So she had to show up and she had to succeed. So after working with her the initial meeting, she walked out of the office, my office. Actually, she danced out of my office. And for the next 2 weeks, her pain was under control and she was able to take care of business. And at that point, we met again and I reinforced the pain control part of the session. Okay, so you want to be able to let them know that there's hope out there and to illustrate it with stories. Okay, all right. Now, for preoperative surgery and during the surgery itself, okay, use of hypnosis prior to surgery reduces the amount of chemical anesthetic needed. In one study, it was shown that only one hypnotherapy session prior to surgery can reduce the amount of chemical anesthesia by 50%. So with anybody that has any kind of fears of anesthesia, anybody that has heart conditions that may be affected by chemical anesthesia, you can reassure them and let them know that because they are doing this, the likelihood is that they will need 50% of the chemical anesthesia that the anesthesiologist will be giving them. Okay. And all right, the next is they're going to have a more relaxed response to the procedure itself. Now, I don't have this information as a reference because I got this information back in 2003 when I was new to NGH and I was borrowing videotapes from NGH National and listening to people who worked with doctors in surgical suites in hospitals in New York City and a small one in Winchester, Massachusetts. According to these trainings, the patient comes out of surgery the same state they went in. So if they go in anxious, upset, angry, frustrated, confused, that's going to cause tension in their body. They're going to come out that same way. All right. So what you want to do is help them relax prior to the procedure. And later on, I'll give you a cue of how you can do that. Okay. So you're going to work on them relaxing themselves and understanding that if they are relaxed, their muscles are going to be relaxed. The surgery is going to go easier. It'll be more effective. It'll be more efficient. Okay. Bleeding diminishes and complications are going to be reduced by 50%. And this is during the surgery as well as after. Okay. All right. Okay. So the time for the procedure is often reduced, even if it's by 17 minutes. And that's what one of the studies says. And because it's reduced, there's less time under anesthesia. It's less costly for the hospitals because it opens up more operating room time for them. Okay. So it benefits the surgeon, the patient, and the hospital. All right. Okay. The amount of narcotics meds needed after surgery is reduced by 60%. And when you are working with the patient doing the hypnosis, you are reminding them of these facts, this research, and you are also weaving in suggestions for a faster, more efficient recovery. You are weaving in suggestions that they are comfortable, relaxed, have a minimal amount of pain, if any. Okay, let's see, I got to stop saying All right. And then it also increases the patient's involvement in their active treatment and recovery. And a lot of times that's so important because they feel out of control. So you want them to know that they are using their subconscious mind, their ally, to help heal them faster. And on average, patients who use pre- and post-operative hypnosis spend a day and a half less in the hospital, although nowadays they pretty much kick you out the door. This research is true as of 2006, I believe. Okay. All right. So after you've taught them the benefits, and this is going to be a very quick presentation. Okay. You're going to design your hypnosis session. You're going to use their safe place. You're going to use positive alternatives to their fears. You're going to change their expectations and reframe their expectations based on their knowledge, their new knowledge about the benefits of using hypnosis pre- and post-surgery. And this is really important. You're going to give them an anchor to cue their relaxation. So once they get to the hospital and you give them some sort of an anchor to cue their relaxation. Okay, after you put on the Johnny and you are sitting under the warm blanket in the chair and the nurses are working with you, you find yourself taking a nice, deep, relaxing breath. And as you do so, you find that you become just as relaxed as you are here with me now. And so you want to give them an anchor, and you can even put in different anchors. Okay, when you're on the gurney and you're taking the ride into the operating theater, that increases your relaxation even more. So you want to give them progressive relaxation as they're going through the process. Okay. All right. Of course, you're going to be giving positive suggestions about the efficiency of the surgery, the surgeon, their comfort on waking. And really important, again, is the ease of their ability to comply with the doctor's recovery orders. What good is it if they go to PT and they don't practice their PT? What good is it if they refuse to take even a little bit of pain medication, and because of that, they become tense and upset and fearful, and then complications begin to arise? So you don't want them to fear taking the medication, but you want them to understand that they're going to be taking a lot less than most people need, and it is going to help them recover much more easily, much more efficiently, without the fear of becoming addicted. Okay. And okay, the ease of their recovery, and of course, the strength of their immune system in their recovery process. A lot of times people might end up, especially if they're in the hospital, they could contract some sort of infection from the hospital, pneumonia if they're on their backs too much, if they're not getting up and moving around. So you want to have them ask their subconscious to fire up their immune system and make sure that they are on, all systems are go on protecting themselves. Okay, and protecting their body and healing in the easiest, healthiest way possible. All right. Oh, so I'm done. That was faster than 45 minutes. I'm sorry. Okay, here are the sources I've used. Meyer, Robert G., Practical Hypnosis from Lexington Books. Carol Lund, who is an RN in research in nursing and health. They did a lot with the patients recovering from surgery. Peggy Huddleston, preparing for surgery and healing faster. Dr. Elvira Lang, who worked at Beth Israel Deaconess Medical Hospital, who did a hypnosis study that was published in the Lancet, and talked again about a pre and post-surgical recovery. And then there's an article called Feeling No Pain, Using Hypnosis Instead of Anesthesia for Surgery. Now, I'm going to go ahead and stop the share, and I'm going to show you a couple of things. Okay. And I also have a, what do you call it? I also have another list of, if you're interested, I can send it out to Danny, and we can send it out through MailChimp, of hypnosis studies, studies using hypnosis for surgery itself. Okay, so we've got this lovely book called Hypnosis Today, and this thing came out, oh my gosh, it was published, I can't find the publication date, I think somewhere in 2000, oh, it's 2007. So I thought I had lost this, and I managed to find it online through a company out of Canada. And what was really interesting to me was there's an article in there, and that's one of the ones that are on the sources, called Feeling No Pain. And it's about a doctor who did surgery at Jacksonville Medical Center, and her clients, she needed to test, she did hand surgery, and she needed to test whether or not the patient could move their fingers in the way that they needed to show that the surgery was done properly. So instead of using anesthesia, she used a psychologist who put this, her patients into a deep hypnotic trance, and she did the surgery, and the patients were able to respond during the surgery so that she could see that the results of her work and whether or not it was successful. Okay. And another thing I use is really important is Heartland's Medical and Dental Hypnosis. And the thing I like about that, and I use it with any and all clients, is there's something called an ego strengthening script. When I took my certification program, I did not know about this book back in the 1993s. However, the teacher of the class had printed out the script for us. And basically, it allows the patient to be fully relaxed and talks about you have become so deeply relaxed, so deeply asleep, that your mind has become so sensitive, so receptive to what I say, that everything that I say will sink so deeply into the unconscious part of your mind and will cause so deep and lasting an impression there. And it will serve you to the best purpose. So that's my spiel. And that was pretty short. Sorry.
Don't be sorry.
Any questions?
Absolutely. That was a fantastic presentation because it was
Yes.
so detailed. It literally gave us just so much really practical information, because I've always thought Eve is so brave to deal with pain things, you know. And so thanks for letting us know how you did it. That's great. Well, just for time's sake, so for our viewers, well, I don't know. Do you guys want to record the Q&A or? Okay, go ahead, Barbara.
Yeah, because I'd like to say that when I was in such pain with my hips, I kept being delayed from my hip surgery. I had to wait almost 6 months to get my hip surgery. And Eve would come over every couple of weeks. And after she left, I was just a different person, because I suffered terribly for the first surgery, waiting the 6 months. I needed it so badly. And just hearing Eve's voice talking me down, I was able to sleep for a while after she left. And I did recover. I was back in my condo 6 days. I'm on the 3rd floor, no elevator. And after a hip surgery, I was back in my condo. So I just believe in it without a doubt, because it affects our immune system. And frankly, I use it because in birthing, it's not an illness. It is unfortunately a medical it's a medical experience, because most people have babies in the hospital, but the hypnosis, without a doubt, makes a big difference on the amount that the mothers handle their births. And it's a powerful tool. And Eve she's a gem at it. She's really great.
Yay, Eve. Thank you. Thank you, Barbara. That was just fantastic.
I have
Yeah.
actually something to add that I didn't put in here, and it's really very important, because especially if you're working with someone who's in pain, one of the things that I can say to them is, now that your body knows what needs to be done and you are getting the medical care that you need, you can relax and let the pain subside, because you don't need it as a signal anymore. However, if you choose not to follow through with the medical procedure that is necessary for your health and well-being, the pain will return. And actually, if you're working with someone in pain prior to surgery, usually every couple of weeks, you need to reinforce it.
Good point. Wow. Absolutely. Thank you so much. So I'm going to stop the recording. Thank you for joining us this evening.